sounds like there's nothing in particular that's going to be new or really different that they're going to get in the United States versus where they are. If there were specific things that they needed, it could have been flown there. This was purely because they wanted to bring these patients home to the United States. Is that right? Is that what drove this?
You'd really have to ask them. It was their decision. But we are here to support the decision and to remember that I know that it creates fear in people, but I really hope that people's fear won't outweigh their compassion. We've got a real challenge in West Africa, and what we have to focus on is stopping the outbreak there. We will be able to stop it, but it's going to take supporting people, and that means that if people who are working on that response get sick, we care for them.
You know, one of the things, Dr. Frieden, that comes up, and you've been transparent about, is lapses at the CDC recently. And there are lapses in hospitals as well with regard to infectious disease protocol from time to time. Even in very good hospitals, as you know, there is a human element to this. So even with the best sort of intentions, Dr. Frieden, what kind of assurances can you say for sure that, you know, with regard to this patient or these patients, that there won't be other infections, that these patients won't somehow infect a healthcare worker or somebody else within the hospital?
Ebola is a virus that can be stopped. It can be stopped in the community by control measures, and it can be prevented from spread in hospitals by meticulous infection control. That means you really have to follow every one of the procedures carefully. Doctors Without Borders, MSF, has been caring for Ebola patients for many years in outbreaks. They've never had a death in one of their workers. So and that's in work in Africa without the kind of advanced infection control procedures we have here. The stakes are higher with Ebola, but the risk is no higher. It's a virus that's easily inactivated with standard cleaning solutions in a hospital. I think we fear it because it's so unfamiliar, but we shouldn't let that unfamiliarity trump our reason about the possibility, the likelihood, the availability of effective infection control in hospitals throughout the U.S. Ebola is a huge risk in Africa. It's not going to be a huge risk in the U.S.
Yeah, and again, you know, it's clear that the resources are more readily available in the United States. They're better, but that human element, again, you're knowingly bringing a patient with Ebola into the United States, a virus that has not been here. And if there is some sort of lapse in the human element of precautions, I mean, how do you tell your neighbors? You live here in Atlanta. How do you tell your neighbors and frankly people in the United States that we are 100% confident this isn't going to turn into something more, even if it isn't a mass outbreak? How can you tell people to be 100% confident that someone else won't die or get sick as a result of this decision?
Ebola does not spread by casual contact, and it doesn't spread by somebody who's not ill. It spreads when people get sicker and sicker and sicker. The amount of virus in their body increases, and so the risk in Africa is the healthcare workers who are caring for them and in the burial process. Those are the two things that are driving the outbreaks in Africa, and we can prevent those risks from happening here.